I'm Juliana. I'm going to be your student nurse today. Is it okay if I record you for a class?
Yes.
Okay, so then I would perform hand hygiene, and as I'm walking in, I would notice that the patient is sitting upright, is alert, awake, and oriented. And can I just have you confirm your name and date of birth before we get started?
Annabelle Joyce, August 1st, 2004.
And I would check and make sure that's what's on her bracelet, and it is. All right, before we get started, are you having any skin issues? So any like rashes, lesions, breakdown?
No.
Any pain in your neck?
No.
Any changes in your voice that you've noticed?
Nope.
So then I would examine her skin. So there seems to be no signs of distress with her breathing. There's no skin changes, such as like cyanosis or pallor, no lesions. Her grooming appears to be intact. And then I would assess her radial pulse. So can I just see one of your hands? And I would do this for a full minute, expecting a rate between 60 and 100. So we'll say, for the sake of this exam, we'll say it's 72, so that would be within normal range. Are you experiencing any pain today? On a scale of 1 to 10, what would you rate your pain?
0.
Okay, good. So then I would move on and inspect her face, upper and lower extremities for color changes, skin integrity, and lesions. So skin is symmetric in coloring. I don't see any lesions, no signs of cyanosis or pallor. Can I see one of your fingers? So right now I'd be looking for clubbing, which there's no clubbing present, so that would be if her finger was like super brown. And there's also no discoloration in their fingers. I'm also going to inspect her head. Her head is round, but not abnormally, so it's non-cephalic. And then I'm also going to look at her hair distribution. So hair is evenly distributed, and there's no signs of alopecia, and it's pretty thick. Her face is also symmetrical on both sides. Her eyes are lined up, her mouth's symmetric, her eyebrows are symmetric. So then I'm going to inspect her facial nerve. So can I just have you smile for me? And her smile is symmetric as well. So I'm looking for, can I have you raise your eyebrows? Okay. So her battery. Oh, it's still recording. Okay, so her facial nerve number 7 is intact. So then I'm going to look for signs of JVD. So if I can have you tilt your head, I'm going to look at the left. And there is no JVD present either, so that would be if there's like swelling in your neck. Can I have you turn your neck to one side and then the other side? And up and down. And is there any pain with any of that?
No.
So she has full range of motion with no pain. I also was looking, when she's looking up and down, I'm looking for any lumps or any swelling in her neck, which is also not present. Her trachea is located midline. And so next I would move on to palpation. So I would start by palpating her neck. So I'm just going to put my hands under your neck. And I just want you to tell me if there's any pain when I do this. Any pain?
No.
Does it tickle?
Yeah.
So she's experiencing no pain. There's also no signs of any masses or lesions. So then I'm gonna touch your face too, okay? Because I'm gonna feel all of your sinuses. So I just want you to tell me if you have any pain in any of those. Any pain?
No.
Okay. So she has no pain or tenderness in her frontal sinuses either. So then I'm going to palpate her TMJ for clicks. So that's your jaw. So I'm going to put my hand on your jaw, and then I just want you to open your mouth for me. Okay. So she has no TMJ. There's no it would make a clicking sound. And did that hurt at all?
No.
So there's also no tenderness. So now I'm gonna look at her cranial nerve for muscle strength. So I'm gonna have you so that actually would be your cranial nerve. So that was intact. And then I'm going to do the sensory. So I'm just gonna use a pencil because I don't have a Q-tip, but normally we would use a Q-tip. So I'm gonna have you close your eyes and I'm gonna poke your face and I want you to tell me if it feels soft or sharp. So if you think it's like the eraser or the tip of the pencil.
Soft. Sharp. Soft. Sharp. Soft. Soft.
Okay. So those were all correct. So her cranial nerve, the sensory is intact as well. So then I'm going to look at the spinal accessory nerve by testing the trapezius muscle, which is your neck. So I'm going to put my hands on your shoulders and I want you to try and push up against my hands. Okay. So her cranial nerve is intact as well, and she had good resistance. So next thing I would do is I'm going to test your skin trigger. So I'm looking for like dehydration. So you're just going to feel a little pinch on your scapula. And there is no tenting, which means she's not dehydrated, and because that's what we're looking for. So then I'm going to look at your lymph nodes. So I'm going to start with your preocular, which is back here. And I just want you to also tell me if you feel any pain.
No.
Okay. And then I'm going to go to postocular, which is behind.
No.
And tonsillar.
No.
And submandibular.
No.
And submental.
No.
And occipital should be like back here.
No.
Anterior cervical, which is gonna be here.
No.
And posterior cervical.
No.
And supraclavicular.
No.
So apparently my patient is very ticklish. There's no palpable lymph nodes. So best practice for those would be all directly on the skin, which I was able to do. So then I would just palpate her extremities. So can I just have you put your arms out for me? So I'm going to palpate using the back of my hand bilaterally. Skin on the upper extremities is warm, dry, and intact. And then I would do your lower extremities. So can I have you uncross your feet for me? So best practice for this would also be directly on the skin. But I'm not going to do that today for patient comfort. So skin is warm, dry, and intact bilaterally. The last thing I'm going to check there is going to be your cap refill. So can I just see any finger? And her capillary refill is less than 2 seconds. I would also do it on her toes. But again, for the purposes of today's exam and patient comfort, I'm not going to do that. And that is all I have for my exam for you today. Do you have any questions before I go?
No.
Thank you for being my patient, and thank you for letting me record this.
You're so welcome.